Dr. Lehman and I both work at the Fetal Care Institute here at Cardinal Glennon Children's Hospital. So we work with a team of maternal fetal doctors and get a lot of referrals from our OBs in the community.
Most families come to us at least prenatally after getting their 20-week anatomy scan. So if the OB will see something abnormal or have suspicion for something, they'll refer them to see us. Congenital heart defects are probably the most common birth defect that someone can have. In the United States, 40,000 babies are born with a congenital heart defect in a year.
Currently, there's not one single cause that causes congenital heart disease. There likely is some genetic predisposition, but then a lot of environmental factors as well.
They tell me what I was having. I was happy because that's what I wanted. I wanted a girl. They just kept having different people coming in the room. Doctor looked and he was like, okay, something's wrong with her heart. It looked like it's not developed correctly. And so I started crying immediately. I finally get what I want, and then something is wrong with my baby,
Dr. Holcomb was on video, and he said, everything looks great. His size is good, his head's good, everything looks, good, except his heart. He said, I think he's got something, I can't confirm it, but I think he's got something called Epstein's anomaly. Cardinal Glennon called us that day, and they said, we're going to get you in on Monday. Dr. Lehman has an opening.
When the family first meets us, and if they come to me first in terms of having a fetal echocardiogram, I'll be in the room with the mom, with the family, and be able to see live exactly what's going on. And then afterwards, be able to sit down with them in a separate consult room and actually give them the diagnosis. And not just the diagnosis, but really what that means.
We got our first echo, and they confirmed that it was Epstein's anomaly. Dr. Lehman sat there and showed us pictures and said, I remember she's like, I'm just going to tell you the rates for an Epstein anomaly. Doesn't mean this is the case for him, but that the living rate is 60%. That was really hard because I cried. I kept thinking, good gracious, you're expecting that you have normal baby, and it just got confirmed that he could potentially die.
You're delivering, pretty devastating news. Their pregnancy is going to not be like their friends and their relatives. From more frequent doctor visits to just the uncertainty and the anxiety regarding the future of their baby.
Dr. Reddy let me know that this is going to be a long road that we have to go through, but I'm going to be here with you to help you through it.
I didn't get to hold him very long, and they took him, and then they wheeled me up to the postpartum floor. That was hard, because I kept thinking, because he wasn't going to come back to me.
She was in the surgery for like 9.5 hours. Dr. Huddleston came out, and I didn't hear anything, but I just wanted to hear, your baby is fine. That's all I wanted to hear. That's all I wanted to hear. Your baby is fine.
They always try to prepare you for what you're going to see when you go in after they've had surgery. Nothing can ever prepare you for that. He was swollen. He was on a ventilator, which we understood that was going to be the case. I just remember crying.
The machines started to come off, and more of the medicine started to come off, and I was just praying. I was praying the whole entire time that, God fixed whatever the problem was.
We're very fortunate at Cardinal Glennon that we have, the latest technology to be able to identify all of these congenital heart defects in these babies and the complexity. We have top-of-the-line ultrasound machine for fetal, but we also have a cardiac MRI scanner. We have a 3D printer. So all the tools that we would need to, diagnose these babies' hearts and understand sort of the complexity and the fine detail is present. Having the supportive resources to kind of uniquely treat this population of patients, whether it's supporting them with having the best technology, having the best operating room machines, having the best ultrasound machines, like every aspect of a diagnostic tool or a technology that goes into either helping us diagnose our congenital heart disease quicker, faster, better, to improve outcomes so that these kids can live longer and live better lives, I think is critical. And so definitely having the funds to support purchasing all this equipment and supporting our support structure or our clinic structure to be able to take care of these kids is hugely important.
I always ask myself, is it better to have found out early or to find out after he was born? Because it kind of dampens your pregnancy because you know he's sick. One of the hardest things is hearing, that he could potentially die. Dr. Lehman was like, nope, that is not what's going to happen here. I believe everything with as well as he's doing, that's not going to be a problem.
Constantly went to see Dr. Reddy. Dr. Reddy was telling me every day she was getting better. And I put my trust in her. And like I said, we're very cool. I love her. That's my girl. And she loves Erin. She'll come from all the way upstairs when we got a doctor's appointment. If we're not coming in there to see her, she'll come all the way downstairs to come find Erin because she know, where's my girl? Boom. There she goes. She come see her girl.
We do follow our own fetal patients throughout their pregnancy and even while they're in the hospital as well. And so I think getting that specialized care of that one person that is your person, basically, who's going to help, right the ship or direct the ship. But yet we also work very closely with our colleagues, and that team approach of knowing kind of what your wishes are and kind of together approaching the family is really important.
The most fulfilling portion of that too is being able to be with the family and be with them, not only giving that bad news, but being able to be present and help them and guide them through this process. I think being able to see our kids grow from babies to infants to toddlers to teenagers, I think that's why we do it.